October is Breast Cancer Awareness Month, but sadly, the incidence of breast cancer in our country is rising. It is close to 200,000 new cases a year, and it is only growing. I'm Dr. Geeta Kadayaprath. I'm a senior consultant breast surgical oncology at Apollo Hospitals, Delhi. The often asked question is, why does breast cancer happen? So there are no easy answers to this question because we do know that there is no direct cause to breast cancer. What we know is that there are certain risk factors. There is a combination of risk factors which come into play and that can give rise to breast cancer. But one must understand that it is eventually happening at a cellular level. When we get exposed to various insults in the environment, that accumulation of insults can give rise to mutations or aberrations at the cellular level, wherein the cell loses its ability to divide in a controlled manner, and that gives rise to breast cancer. The other thing one would ask is, what are the symptoms of breast cancer? The most common symptom, and unfortunately the most ignored symptom of breast cancer, is a painless lump in the breast. If you were to find a new lump in the breast which is painless, you must report at once to a breast surgeon. The trouble is, a lot of people procrastinate with a painless lump and think, oh well, it will go away because it is not causing you any problems. So that is the commonest symptom. Other than that, you could have a nipple which is kind of dipping into the breast, or there could be a dimpling of skin. There could be nipple discharge, which could be bloody or transparent and happening spontaneously, or there could be a change in the shape of the breast, or even an orange peel-like appearance of skin of the breast. These are some of the symptoms that one should be wary of and must report to your doctor if you were to see any of these symptoms. One often asks, is breast cancer painful? Usually not. Like I said, it is often a painless lump. A pain can be a presenting symptom in about 7 to 8% of patients, not more. So how does one find out whether one has got a breast cancer? There are various methods to screen for breast cancer, one of them being a mammogram. So the recommendation from the United States is that one should do it every year after the age of 45. But UK is more conservative, and in a general risk population, they would say once in 3 years. The ones who have got a high risk owing to a high risk family history or some mutations in the family, they would be asked to get a mammogram done every 18 months. So there are varying recommendations abroad, but we don't have similar recommendations in our country. And for a hugely populous country like ours, it is kind of too much to expect that every woman would have an opportunity to get a mammogram done at regular intervals. So then we should fall back on the next best thing, and one of them is to go to a surgeon or a health professional who can actually examine your breast once a year after the age of 40. And one weapon which I think is very much within your hands, and that is your hand itself, and that is breast self-examination, which should be done on a regular basis every month, diligently, conscientiously. Make sure that the entire part of your breast is covered when you're doing a breast self-examination. That is very important. And you could be having nodular breast and you may think that everything in your breast is a lump, but that familiarity with your breast is what is going to help you catch any abnormality early if it were to surface. So breast self-examination is something that I would strongly recommend, and it should be done a week after your periods if you're continuing to have your periods. And for those who are menopausal, just fix a date which coincides with your birthday, or the first of the month would suffice as well.